The way we like to have our patients come in, we like to have them fill out a questionnaire online. And when they do that, then we look at their questionnaire and make sure that they're candidates for this kind of treatment. And that's very important because we don't take care of 19-year-old males who want to have testosterone. That's not going to happen. We aren't going to have them make an appointment. We only want to see people we can help, and that it's safe to help, and that it's replacement and not augmentation of hormones. So that's the first thing. Then when you get through the process of filling out the questionnaire, getting your blood drawn, I look at everything. And then if everything looks like I can do you some good, then I have you come in for an appointment, because I don't want to waste your time or money, and I don't want to waste my time. So I want to see people I can help. If there's another problem and they need to see a different kind of doctor, we'll refer them without even seeing them yet, because we see it on the lab. Now, when somebody comes in to see me, they see me, and I go over everything. I go over their labs, their lifestyle, all their symptoms, everything that is possibly connected to andropause, menopause, lack of testosterone, or aging. We go through all of that, and then a lot of unhealthy lifestyles I deal with and try to help people get their weight off so they don't become diabetics, or if they have signs of risk in their lab, I try to get that risk down. If it's risk for heart disease or risk for diabetes or risk for something else, I address that as well. So then I decide on a dosage with the patient, and the patient has their pellets on the first visit. That is, we then give them instructions and that kind of thing as anybody would if they were having a little procedure. It's not really painful. We give them lidocaine, and it's just putting little like seeds in women's hips and men's love handles, because that's where their fat is. And then we have them call for any problems or email to our nurse practitioners. Then I see them back at 3.5 months, because they have their pellets in 4. So I get blood drawn at 3, it takes 2 weeks to come back, and then I see them at 3.5, and we go over everything that has happened, all the good stuff, anything that didn't come up to their expectations, and then we go over how to tweak it. And then I see if I can take care of how to adjust the dose next time or change some of the supplements, and then they get their next dose at 4 months. Some people can go 5 months. If they're over 65, sometimes they can go 5 or 6 months. That's infrequent, and most of my patients are under 65 at this point. I do have some 85-year-old patients, but they need their pellets about every 6 months. But in the end, we will walk you through this, take care of everything, make sure that you are getting the care that you want and that you're getting the outcome that you want. Now, I do have some patients very few, that don't get the outcome that they want. There's definite reasons for that, and we figure that out. But oftentimes we have to send them to another specialist. But really, what else is 90% effective or more? Nothing in medicine that I've ever seen before. This is truly amazing, and the downside is less than taking nothing. If you take nothing, you have higher risk of heart disease and breast cancer, Alzheimer's, osteoporosis. I mean, so many things that can hit you later on down the line. You're not going to have that if you take pellets.